Hello, today we are going to discuss depression and advanced directives for pulmonary patients. So this is just really important because depression will affect your respiratory system and how you breathe. It does have a major role in that. And then we also discuss advanced directives as far as with pulmonary disease, because unfortunately it is progressive, and so we do need to discuss that as well. So as far as depression goes, it affects about 10% of Americans over the age of 18. And then about 40% of pulmonary patients are going to experience depression at some point after their diagnoses. And this has multiple effects. So not only is it going to affect you physiologically, so it does have an effect on our entire system, but it's also going to affect you behaviorally. So you have decreased motivation to exercise and eat healthy. Whenever you're feeling depressed, we tend to want to sleep more and not really do a whole lot. Decreased motivation to follow medical advice, so we tend to take less medications or not take our medications appropriately. Same with that, we also self-medicate with tobacco and alcohol and sometimes drugs. Skipping medications because either you just don't get out of bed that day because you're just feeling so depressed, or it's just not something that you're worried about or not thinking about, or you just don't want to. And then guilt about past behaviors. So it is really easy to feel guilty about something that we did that may have caused our diagnoses. However, we can't change any of that. So we definitely want to work on kind of looking forward. What can we do now to help improve our health and do what we can to stay as healthy as we can from here on out? And then physiologically, it increases the level of your stress hormone, cortisol, which also increases inflammation in your body. So when you're chronically depressed, you have a tendency to feel more, sore. So you're going to have more pain throughout your body because of that increased inflammation. It also does increase inflammation in our respiratory system, which will cause more shortness of breath as well. It also causes increase of your stickiness in your blood platelets, which can cause increased risk of blood clots throughout your system, accelerated hardening of your arteries, which can cause heart disease, which can also lead to more strain on your respiratory system. And then it has a disturbance in your nervous system, which causes your increased heart rate and arrhythmias. So it can cause some pretty concerning arrhythmias that do cause more shortness of breath as well. So common signs of depression, I want everybody to know this not only for yourself, so you can recognize it in yourself, but so you can recognize it in other people as well, because that can be very important. So feelings of sadness, just generally feeling sad, irritability. So if you just fly off the handle for no real reason, right? You dropped your pencil and you got super angry and just went off the handle, that is a sign of depression. Loss of appetite, or on the other side of that, overeating. And with that, you can go back and forth. So one day you can not eat anything, and the next day you can eat everything. Or even, just kind of throughout the day, it can change. And then same with difficulty sleeping or oversleeping. So excessive fatigue. So same thing, it could be day to day, it could change. But if you're having those things and you're having those mood swings where that's happening pretty consistently, you definitely want to talk to your doctor. Feelings of worthlessness and lack of self-esteem. And then one that we can recognize, and one of the first symptoms that we can recognize in other people, and same that we can recognize in ourselves, is loss of interest in doing normally pleasurable activities. So things that we like to do, suddenly we just have no motivation to go do those. We're canceling plans more frequently. So maybe we like to go out to lunch once a week with our best friend, or maybe we like to go golfing, or whatever that may be for you that you normally like to do, and you just find yourself canceling that all the time, really not looking forward to it, not wanting to do that, that can be a sign of depression. And then crying spells for no apparent reason. So we've all heard the saying of no need to cry over spilt milk. if you are crying over spilt milk and you find yourself just crying at the drop of a pin or because you spilled your milk or just randomly throughout the day, that is also a sign of depression. So how do we beat depression? Now that we know what it is and how to recognize the symptoms, what can we do? The biggest one is your diet. So the good we put into our system is the good we're going to get out of our system. So that is really important to recognize for everybody. We want to eat healthy foods and have a nutritious diet because our gut health does play a huge role in our emotional health. In addition, drinking lots of water. So about 75% of your brain is water. So when you're chronically dehydrated, that will affect your hormone levels, specifically serotonin in your brain, which is your mood regulator. It also, so skipping meals and same with like eating too many sugary foods, so increasing that blood sugar. And when we skip meals, our blood sugar drops. If we eat too much sugar, our blood sugar goes high. And then we have this tendency to kind of go like this with our blood sugar, which affects our mood stability. So our moods will also kind of follow that same pattern. Kind of if you think of kids, when you give them too much sugar and then they crash, same kind of idea. So paying attention to that. Omega-3s. So omega-3 fatty acids have been shown to improve cognitive function, reduce inflammation, and lower depression. So good sources are going to be salmon or any cold water fish, flax seeds, walnuts, free-range eggs, grass-fed beef, those kinds of specific areas. And then getting your B vitamins, so specifically B12 and folate, which is B9. Those have been shown to also play a role in depression. So when you're low on those, you tend to be more depressed. Good sources of those are going to be found in fish, poultry, meat, eggs, dairy, fruits, vegetables, whole grains, beans, legumes, all of those areas. And then minimizing your dietary sugars, which we did talk about. And then the one that we like to push the most here, which is exercising regularly. So we talk about that a lot, not only for your respiratory system, not only for your physical health, but it does play a major role in your mental health. We've all heard runner's high. So that runner's high is not because you went running. It is because you exercised. So when we exercise, our body releases endorphins, which makes us feel happy. So most people, I've never had somebody say they regretted coming to class and exercising. So most people are going to feel better after exercise, which is because of that release in endorphins. You don't have to run to get that. Just getting your blood pressure up, your heart rate up for an extended period of time will release those same endorphins and just make you feel happier in general. It's also a good way to help get out kind of your frustrations. Avoiding alcohol. So if you're feeling depressed, alcohol is a depressant, which is just going to make the situation worse. It's going to spiral downward. So if you're feeling depressed in any way, don't drink alcohol. Reach out to us, reach out to your doctor to get resources and help with those things because alcohol will make that worse. And then with that, finding social support. So we do pulmonary rehab in a group setting for a reason. It is because there are other people in class that are going through the same thing as you. I can talk to you about your lungs until I'm blue in the face. I can tell you all you need to know plus some, but I don't know what it feels like to be in your position. And so having people that do know what that feels like, that have been there, is really important for humans. We like that interaction. We like to know that we're not alone in certain situations. And you can also find other social support. We have handouts on the Better Breathers Club. So if you want that, let us know. And then professional support. So don't be shy to go see a professional psychologist, counselor, anything, grief counselor, anything that you may need help with, speaking to a professional. Sometimes it can be really hard talking to family. A lot of patients express that it feels like they're a burden when they try to talk to their family about how they're feeling emotionally with their physical health. So speaking to a third party that you don't have that same connection with can be really helpful for your mental health. And it can help you get on medications. So medications can help in one of two ways. So one, it can be a bridge to getting you into a healthier lifestyle, which then you can wean off of those medications. So sometimes you're just so far into your depression that you can't make those healthy lifestyle changes because of those behavioral factors that depression causes. And so sometimes you need medications that are going to help balance out those hormone levels in your brain and your chemical levels, which will allow you to then make the behavioral changes and then wean off of those medications. And then other times you may just need those medications. Some people just have chemical imbalances or hormone imbalances for various reasons. You can be doing everything correctly and still feel depressed, in which case getting on a medication can be very beneficial for you. And I don't want you to think that that's not an option, because it definitely can be, and it can help you feel so much better to be able to continue living your life in a meaningful way for you. And then other resources are listed on the handout that you guys got. So the last thing we're going to speak about is advanced directives. So it's very important to have an advanced directive in place for everybody. These are not an all or nothing. So a lot of people think either you have to have every treatment or you get no treatment. That is not true. There is a whole bunch of gray area in there that you can pick. So definitely sit down with your doctor and talk about this, because unfortunately lung disease is progressive. And even if it wasn't, it's important to have it, because even I have one, because I could get in a car accident tomorrow. And it's important for me, for my wishes to be met when I can't make those decisions because of the state that I'm in. So having those discussions with family members and getting it in writing when you're still of sound mind, and signing that, because nobody can overrule that. So if you have it signed and it is legally signed with your physician, nobody else can say otherwise, which is really important. That also takes that burden off of your family in that situation of having to try to make those decisions and guess what you would have wanted, along with managing their emotions and trying to not do things just because of how they feel in that situation, but because that's what's best for you in that situation. So definitely talk to your doctor, talk to your family about your wishes and what you would want in those situations if you're unable to make those decisions for yourself. If you guys have any questions, let us know. And then we also have additional resources available up front, so just ask us for those.